Depression, Brandy Mora. Major depressive disorder, or MDD, is a chronic and potentially life-threatening disorder affecting about 10% of the U.S. population each year. Currently, depression holds third place on the world's list of disabling disease, with an expected move up to second place by 2020. A major focus on what causes depression is the area of the brain known as the limbic system. Important portions of the limbic system involved in emotions and our physical and sexual drives include the hypothalamus and pituitary gland, which regulates hormones. The amygdala and hippocampus are also part of the limbic system and important in the regulation of emotion. The neurotransmitters associated with depression are serotonin, norepinephrine, and dopamine, but serotonin has become the focus as a catalyst for depression. Sufficient serotonin levels are integral to elevated mood and happiness and can be achieved through changes in our diet. Serotonin works through its release from the presynaptic axon into the synapse, where it is either absorbed, binds to the receptor site, or is reabsorbed by the presynaptic neuron. The serotonergic system is of specific interest as it also interacts with the adrenal gland above the kidneys during times of stress. For this reason, serotonin neurotransmission has become the focus of many psychopharmaceutical interventions for depression. Selective serotonin reuptake inhibitors, or SSRIs, have become one of the most common interventions for depression. These medications work by blocking reabsorption or reuptake of serotonin. This is done through agonist activity, meaning they are effective because they block reuptake of serotonin, increasing serotonin activity in the synapse. SSRIs do not block postsynaptic serotonin receptors. Therefore, the primary acute neuronal effect of SSRIs is to make more serotonin available in the synaptic cleft, which activates all of the many postsynaptic receptors for serotonin. SSRIs have a long half-life, which contributes to their delay of onset and alleviation of symptoms. This can be remedied by use of more specific SSRI interventions or a combination of SSRI treatments to enhance serotonin increase. While sertraline and fluoxetine were the first produced and are most commonly prescribed depression interventions, new multimodal SSRIs also show promise in alleviating symptoms. SSRIs carry little to no risk of overdose or abuse, with few side effects such as insomnia, hypersomnia, nausea, and sexual dysfunction. Two important considerations with these drugs are serotonin syndrome, a byproduct of overproduction of serotonin, and SSRI discontinuation syndrome associated with abruptly stopping treatment. Depression is considered a neurodegenerative disorder, meaning with continued pharmaceutical intervention, it is theorized the brain may repair or generate new neurons. It has even been proposed that the therapeutic delay in most antidepressants is connected to neuronal development and allows for time for repair and neurogenesis. While the risks associated with SSRI intervention may be low, for patients with mild to moderate depression, antidepressants remain frequently prescribed with little efficacy and with some bothersome side effects, or even suicidal ideation. This lack of response is frequently termed treatment-resistant depression. However, individuals not treated for depression experience a loss of pleasure in daily activities, have trouble sleeping, and no energy to carry on throughout the day. They experience feelings of guilt and worthlessness, as well as death and suicide. Severe depression often leads to psychosis and carries a high mortality rate. Approximately 89% of the population goes untreated for depression. Other treatment options include psychotherapy or counseling, but due to the many factors associated with appropriate SSRI administration, it is recommended to increase the dose, switch to another more effective SSRI, or add a second antidepressant for the treatment-resistant patient. The combination of coping psychotherapy intervention and SSRI administration is considered the most optimal treatment for MDD.